Last meeting, we have started already discussing infection as a topic in microbiology. For this time, we're going to continue the discussion by looking into the causes and how to prevent infection. Causing an infection is actually caused by pathogenic microorganism. And how do these pathogenic microorganisms cause infection? One is they produce toxin which can harm the body. An, an example to this is the Clostridium tetani, or in layman's term, how tetanus happens. So the Clostridium tetani enters to the body, and then tetanus could come in once the Clostridium tetani had emitted or had excreted their toxin to the body of the host. Another way of infection is allergic reaction in the body, manifested or causing runny nose, watery eyes, and also sneezing. Actually, these are common symptoms to those persons who are suffering from rhinitis, in which all they claim is that there's something wrong with their eyes, it is too hot, and tears comes out. And then frequent sneezing is also one common allergic reaction for the respiratory system. Another way in which a pathogenic microorganism cause infection is they attack and destroy the living cells they invade, especially our blood or the red blood cells. So the famous cases of malaria is an example of attacking and invading of pathogenic microorganism to our healthy living cells. And then in order for disease to occur and spread from one individual to another, certain conditions must be met. If any one condition is not met, the transmission of the disease will not happen. And then pathogens are everywhere, and preventing their transmission is a continuous process. This slide, I would like to take advantage of the COVID-19. So, in order to cause infection or transfer of disease from one host to another, or transfer of COVID virus from one person to another, is the disease to occur and spread from one individual to another, certain conditions must be met. So, what we are trying to do actually is we are not trying to meet the condition wherein the COVID virus or the COVID-19 will spread. So in order to prevent infection, that is what we are doing. So we are practicing the wearing of masks, the social distancing, and in some cases, avoiding gatherings. Or safest, stay at home and increase your resistance by eating the right food or having the right physical activities. If anyone is not met, the transmission of the disease will not happen. So if we are healthy, we have a clean surroundings, uh, there are no spoiled foods, the water is clean, then there will be no habitat or reason where the infection would come in. Remember, pathogenic organisms are everywhere. Mycobacterium tuberculosis, the bacteria responsible for tuberculosis, is just simply everywhere. But if the individual continuously maintain a good health, maintain cleanliness, the spread of Mycobacterium tuberculosis or tuberculosis will be prevented. So these are the things that we should always try to consider, especially if there is an epidemic, more if there is pandemic. No one was exempted to tell, I do not know what is pandemic. We are all exposed. We have all experienced what is pandemic. So we have also experienced, everyone have experienced also epidemic. So these things are the guiding principles, or we could say that these are things that we should consider in order to prevent the spread of microorganism. Okay, let us try to look into the chain of infection for individuals. So first you have the infectious agent. As you have learned, it could be animate or inanimate object. It could be human. It could be an animal. It could be a plant. Or just simply droplets from the air or even water. So we have the reservoir, the portal of exit of the microorganism towards a new probable host, and then portal of entry to the new host, and then looking into another susceptible host. If the microorganism if the microorganism fails to look for a portal of entry, so if this is broken, infection will not occur. So the probability of looking for another cause will already stop. Okay, okay. Chain of infection is the model that was shown to you. It's usually used to understand the infection process, especially in the case of uh, animals or specifically as a human. Each link represents a step in the transmission of disease, and each link has to be present and in order for an infection to occur. As I have made mention, if there is no host, there is nothing to transfer. If there is no microorganism, there is nothing to transfer. And if there is no receiver, then just as the same, there is nothing to transfer. And since there is nothing to transfer, then infection is prevented. Okay, let us try to discuss each component of the chain of infection. We will start with infectious agent. Okay, the pathogenic organism, let's start discussing the pathogenic organism. The bacteria, the virus, the fungi, the parasite are actually the main causes causing living organism towards infection. So if all of these are absent, there is no infection. But the presence of one or two or even more that could lead to adverse effect could give a positive manifestation of the presence of infection. And then the reservoir. What do we mean if we say the reservoir of microorganism? It is actually the place where the pathogen live and reproduce. So all of us are probable reservoir. The bottle of drinks that we are about to take in could also be a possible reservoir. It is an inanimate reservoir. Another is the handkerchief or even the ball pen that we are using or even the food that we are about to eat. These are possible uh, reservoir of microorganism. So I am not trying to create fear, but I would like to tell you that the doorknobs that we usually hold on to enter or exit a living place or a place to live in are carriers of microorganisms. So reminder, if you go to a certain room or certain office, and if you have held the doorknob, please apply alcohol later on. If you go to grocery, if you go to cinema hall, if you go to restaurants, as much as possible, wait for the security guard to assist you to open the door. Because if everybody is holding into the door or onto the doorknob or to the door itself, that big metal, silvery metal, if everybody is holding that, it means that there are a lot of microorganisms that have been introduced to such part of the door. And then you have the bed pans. This is already talking about the hospital. So even in our own home, our own bed sheets, our own pillowcases, or even the pillow itself could be a place where microorganism could grow. And then also likewise the instrument in the hospital is one. And also likewise our own kitchen utensils, electric fan in the sala, electric fan also in the bedroom are possible places where the microorganism could enter, survive, and reproduce. Okay, we are going to discuss also the portal of exit or from the reservoir, how could they have a takeoff? The portal of exit should be defined as the way to escape or the way to move out from the reservoir in which it has been growing because uh, the microorganism might be already so loaded, the microorganism are already too healthy and capable to look for another host. So the next thing that we have to consider in infection is the possible going out of the microorganism from the host. Once we have stopped the portal of exit, once we have destroyed the portal of exit, then we have already prevented the presence of infection. But if we fail the functioning of the portal of exit, then the mode of transmission could also come in. Now, what are we going to look at as a portal of exit? Okay, the urine could be a portal of exit. The saliva could also be a portal of exit. The respiratory tract could also be a portal of exit. Just as the same, our gastrointestinal tract, mucus discharge including uh, the phlegm, a simple hiccup could also lead to the formation of or discharge of unexpected mucus. And then the skin could be a place where the microorganism could exit the blood and then also the tears and other liquid that are emitted from our body, including perspiration. No? Okay, how could mode of transmission come in? It can be through direct contact of airborne droplet, or it could be transferred through contaminated hands, or just simply a bump of using contaminated uh, handkerchief, or even ball pen or papers exposed to uh, places wherein possible microorganisms are present. This is the reason why the CHED had advised to decontaminate every module that they receive from their students or pupils. There are also some municipalities or even capital buildings have the papers to be subjected for radiation in order to prevent possible microorganism present in there to be transmitted to other persons. Okay, you can see from the illustration how a simple sneeze could carry so much droplet to the host and to the receiver. So the mode of transmission here is actually the different droplets emitted from the reservoir down to the probable host. We might have clean hands to see, but if you're going to shake hands with some other people, you do not know if such people have their own microorganism. Even the beast bump, di ba, the shaking of hands was not a practice lately, but rather the fist bump. What if this portion of the hand is also contaminated with microorganism? I think that is also not a good practice. Still, one of the best practice is a frequent washing of hand in a minute or two, and also likewise the use of rubbing alcohol to decontaminate all these things. So far, hand washing is one of the most effective means of preventing the spread of pathogens, both at home and the school. More so in the hospital. Maybe you have watched some movies or documentation as to how the doctors wash their hands before a surgery. Washing of hands is actually up to the elbow, and then they are washing every part of the fingers. They are washing in between the the fingers. They are washing the wrist, and after washing, somebody has to wipe off the excess water, and then the highly sanitized gloves will be placed or will be used by them. The most common um, mode of transmission is the respiratory droplet. The respiratory droplet could not only be created through sneezing or through a cough, but just simply talking is also a way of secreting respiratory droplet. So that if you're going to get a mirror and you talk to the mirror at maybe 1 foot distance or at a talking distance, you will take note that the mirror will be wet out of your uh, way of talking. You can see the saliva already adhering to the side of the mirrors. Okay, so sometimes if you go to the cinema or if you go to the shopping mall, do not talk so near to the mirror because some droplets might be there that you can get. And then respiratory droplets do not circulate in air for a long time or travel. So ideally 3 feet, or that is more than a meter. That is even the reason why we have the 1 meter or 1.5 social distancing in order to prevent to be contaminated with coronavirus or the COVID virus. Many diseases spread by respiratory droplets. Not only our COVID, but also the case of MERS, the SARS, or even simple flu could be taken by simple respiratory droplets. Japan had been using already the surgical mask even before the incidence of COVID because Japan was one of the early victims or uh, early host of SARS. Respiratory droplets could spread germs directly or indirectly. This is a thing that you should always try to consider. Okay, so the water droplet, I'm giving an emphasis to this. An agent is coughed or sneezed into the air and floats onto the droplets. This is how the coronavirus could be transmitted. The carrier is are the droplets emitted from the COVID patient. Close contact with infected persons with cough, sneeze, toxins. Droplet lands directly on mucous membrane or to the susceptible individual. So, droplets with infection agent could land on the table, could land also on the armchair that you will be using, or could also land at the back of the chair in front of you. So I advise you to bring your alcohol uh, when you come back to our school. Or from time to time, you should practice already or have the habit of washing your hands, or if not, the use of alcohol, preferably the 70% alcohol. So you can see now how a probable uh, agent could contaminate or could infect a certain person. Just a droplet from table to a table, directly from hand to nose. Just a simple touch is dangerous. Just a simple kiss would also be dangerous. And then, of course, it's very obvious the cough. It is not only within the parlance of ethics, but within the parlance of maintaining a physical health, that we should also cover our hands while we have the cough. Okay, these are other methods of transmission. It could be from food contaminated with um, microorganism or foods that are not properly uh, treated in order to prevent contamination. The food is just simply left open, and the entry of lice carrying the microorganism is happening. or even cockroaches crawling at night could also lead to infection. Even mites uh, could carry microorganisms. However, we have also some human activities that could lead to infection from one person to another, like the transfer of sexually transmitted diseases, or even the use of needles from one person to another. Okay, my dear children, I would like to require you to practice this thing. What do you need to do? When you come back to UNP, please have the following. Make sure that you have available supply of masks, tissue paper, alcohol. I do not recommend the alcohol gel, but it is also effective to use. I discourage you to use it because it is expensive as compared to alcohol. And the strength in fighting microorganisms, alcohol is better than your gel. Trash cans with good pedal to leaf lid for disposing tissues and masks are present in UNP, but I do not recommend you throwing away masks inside UNP. You bring home your mask. Okay, what are the portal of entry of microorganism? One is the damaged skin, uh, influenza, or flu, or even cough. If the virus enters to a damaged skin, cough or flu will not happen because microorganisms have their own identified portal of entry. So in skin infections, related diseases, look for a damaged skin. A simple crack or a simple injury could welcome the entry of microorganism. Eating is one way of transferring a microorganism from inanimate object to another. So that leads to the entry towards the gastrointestinal tract or the GIT. And then the mucous membranes. And also another is the respiratory tract. Internal organs or organs as portal of entry are the subject of interest of microorganism for infection. So for respiratory, it could be done through inhalation, like the case of the COVID. That is the reason why we are using the face mask. And we will only, it is only recommended to stop using the face mask if we will be under alert zero in terms of COVID. As of now, generally the Philippines is at alert level 1. So we could not yet bring down our face mask if we are in public places or in gathering. Another is our skin, the biggest organ of the body, is a point of interest for infection. And then the social contact, sexual organs are also portal of entry that is for pleasure, but that pleasure could lead to infection. The very sensationalized HIV uh, could kill a person slowly but not gently. So you have the sexual contact. And then ingestion, or just simply eating, could also lead to infection. And the usual symptoms are stomach ache related or even the presence of diarrhea. And then we have to go to susceptible host or the receiver or the owner of the organ that is identified as a portal of entry. So who are those persons who are capable of being infected are the susceptible hosts. So microorganisms must be present in large amount enough to be virulent in order for the susceptible to suffer the infection. So our next business is how to break infection. Of course, we do not encourage infection. Uh, the reason why we are studying infection is to know the liabilities or to know the weak points of the infection. So we have to know and discuss how to break or destroy the chain of infection. Okay, let's take first respiratory hygiene as one. To reduce transmission of airborne diseases um, is one of the objective of respiratory hygiene. Another is hand hygiene. Make bubbles, not germs. So it means that you have to wash your hand. So make bubbles. Use the soap, not the germs. Wash hands frequently with soap and warm water for at least 20 seconds. 1 minute is even preferable. Then make use always of our alcohol or even our alcohol gels. Gloves could be recommended to be used if you are exposed or doing some activities that will make the individual susceptible to probable infection. And then we have the cough etiquette. So stop germs spreading, cover a cough. So that is also one reason why we have social distancing during the onset of or while we are under the pandemic COVID. Keep your working area clean, not only the eating places but also other places where we usually stay like the bedroom, the living room, or even the classroom. UNP is advised to decontaminate classrooms from time to time. So you do not be surprised if there will be some announcement that uh, the decontamination or even purifying air or um, sometimes will be taken from your classes in order to facilitate decontamination of air. Habits to break the chain. Avoid close contact to persons who are sick. It is nice and psychologically it is good to visit persons who are sick, but maybe we have learned our lesson that going to the hospital to visit a sick person is not that practical, not recommended. Let us give ourselves to be free from a possible exposure of microorganism, and at the same time not going to the hospital to visit a friend who is sick gives more time for the patient to rest. Because, sometimes instead of the patient to be resting in the hospital, the patient is accommodating visitors going to the hospital. Okay, stay home when sick. Anyway, you are excused if you say you are really sick. But use sickness if you are really indeed sick. Cover mouth or nose even with tissue paper or even your handkerchief when coughing or sneezing. As much as possible, avoid touching the nose, your mouth, or your eyes. But Filipinos was found out to have the mannerism of touching their nose or even rubbing their eyes when they are not comfortable with the with the environment that they are in. Those are psychological mannerisms. Wash hands often with soap and water or even have an alcohol rub. Maintain vaccination. I will not discuss this anymore. This is totally discussed in uh, the media, be it the social media, the television, or even the radio. But listed in front of you are the common vaccine that uh, we usually are exposed with or experience having a shot of this. And one of the requirements in entering for a face-to-face class is that you should be fully vaccinated. And then we have the body defenses. If defense mechanisms are intact and the immune system is functioning, take note, a human can frequently fight off the causative agent and not contract the disease. And these are your body defenses, and these are the things that you should always take care that this and ensure that these are things or parts of the physiological body in order to prevent infection. So try to take note of these things. Mucous membrane traps pathogen. Cilia as individual parts of pathogenic microorganism could propel within the body system. Coughing and sneezing could be controlled, or the impact of coughing or sneezing in the transfer of diseases could be controlled rather, and then the hydrochloric acid in the stomach or any other secretions in the GIT or any system could help you uh, prevent the entry or the reproduction of microorganism if you maintain a healthy production of these body fluids. Okay, these are usual posters that we see in order to prevent infection. There are some measures that we should consider if we visit a family in a hospital or in a facility. And then the second poster will show to you what to do if someone is sick in your household. Number one, there is isolation, and that is usually the advice of our physicians or doctors. When somebody was positive with AIDS, we have even our isolation centers, no? Isolation facilities. If we cannot isolate our members of the family who are sick, so we isolate them, we give them the proper care, proper food, proper ventilation, and also likewise psychological entertainment in order for the patient to be of a brighter mood during the times of sickness. And then we reduce contact of the virus by giving them or assigning a set of utensils or things to be used as an individual, like towels, uh, his own foot rug, beddings, even things to use in eating. No? Okay, the World Health Organization just also shared to us posters about proper way of dealing the COVID-19. I just found out I am confirmed contact for COVID-19. I think you are familiar with what to do. So when you will be back in your own classroom, always wear your face mask and sanitize your hands. So we will be, the university is eager to see you, eager to be with you, and personally learning with the facilities that we could offer. So this is all for now, and then hoping to see you soon. So please maintain good health, avoid doing things that could lead for possible infection or exposure to things that could uh, lead anyone to infection. Okay, thank you for now.